Let's get started. Thank you again, everybody, for switching over to Microsoft Teams. My name is Mark Fransham. I'm a departmental lecturer and social research officer here in the Department of Social Policy and Intervention. And this is the first in our series, Modern Methods in Social Policy and Intervention Research. I'm very pleased today to be welcoming as our first speaker, Dr. Carl Bonander, who's going to talk about synthetic control methods, and he's going to give us an introduction and overview of recent developments. And thank you ever so much, Carl, for being here, but also for switching over platforms as well with a few minutes notice and being so calm about it. Thank you ever so much. So Carl is a university lecturer in the School of Public Health and Community Medicine at the University of Gothenburg. His research is focused on injury epidemiology and injury prevention from a societal perspective. He's particularly interested in the development of methods for identifying the causal effects of societal safety interventions, as well as socio-demographic inequalities in health and safety. And also, Carl is not a stranger to the department, because he's co-authored with several members of the department. And later on, I'll be calling on one of his co-authors, Michelle Degli Esposti, who's a postdoctoral researcher in the department, to kind of offer her reflections on synthetic control methods as well. So, Carl, I think you're going to speak for about 45 minutes, I think, give or take. I will, Carl, just to let you know, I'll turn my video off while you're talking, but about 5 minutes before the end, I'll pop up just to remind you you've got about 5 minutes to go. And then we'll have, 40 minutes or so for some questions and discussion. But Carl, can I leave the kind of virtual floor to you? And thank you very much.
Sure, thank you. So I'll just share my screen here again. So we're good? You can see that? You can hear me?
Yes, we can see that. That's great. Yeah,
all right, fantastic. Good. I wanted to ask one thing before I start. Can you see my mouse when I?
Yeah, I can see your mouse. Yes.
Okay,
yes.
Good. Yeah, good. Because I'm going to point at some stuff. So right. It's all good. All right. Thanks all for joining us. So in this talk, I will provide a non-technical introduction to the synthetic control method. Kind of target audience for that part of the talk is basically those of you who are new to the method, or maybe have heard of it but don't really know exactly what it does. And I realize, this is a broad audience here, so I'm going to try to make this interesting for as many of you as possible, hopefully at least. So towards the end of the talk, I will also provide a little bit of an overview of recent advancements in the synthetic control literature, maybe aimed a little bit more at those of you who are familiar with the method but want to learn more. So whenever you hear people talk about the synthetic control method or write about it these days, you'll probably see them cite this paragraph of a review paper by Athy and Imbens, published back in 2017, where they write that the synthetic control approach developed by Abadi, Diamond, and Heinmüller, and Abadi and Gardaziabol is arguably the most important innovation in the policy evaluation literature in the last 15 years. So that's a strong statement. We'll see towards the end of this talk, when we get to the discussion, if you agree or not. So just to give a quick overview of the history of the method. So it was actually introduced back in 2003 by Abadi and Gardaziabol. We'll look at that paper later and see a little bit about the kind of case study that they look at. But what they do is they study the economic costs of conflict in the Basque region in Spain, and they felt that they needed a new method to do that credibly, which is why they developed the synthetic control method. It was actually in 2010, so 7 years later, it was formalized by Abadi and two other co-authors, Diamond and Heinmüller. And at that point, they also released software so that you could actually apply the method. And before this talk, I did a quick search just to see like how many how many people have actually published papers with the keywords or a title or abstract that mentions the synthetic control method. We can kind of see that from that point, it's kind of increased exponentially over time. So I guess they've done something right here to make people that interested in using the method. And after that point, there's been some interesting developments in the literature that I will go through briefly at the end of this talk. But so just to set the stage, and kind of circle back to what it actually what is it trying to do? So suppose that we want to estimate the effect of some policy change on an outcome, and that could, for instance, be the effects of Florida's stand your ground law, which is it gives people the right to use deadly force in self-defense. I'm simplifying here a bit, I think, but that's the general idea. And I think the main purpose of that type of law is to deter from crime. But there's a debate in the literature here, because it does seem like maybe it actually increases at least homicides in some states. One of them may be Florida. So I picked this as a kind of case here because some of you may be familiar with this intervention, since it's been studied by some of the researchers at your department. So I figured, why not run with something that's familiar. So to estimate effects, we need to try to estimate the counterfactual. So what would have happened without this stand your ground law in terms of homicide rates in Florida? And this is just some raw data. So here we see homicide rates per population in Florida over time. And the stand your ground law was implemented in October 2005. You can see that in conjunction with that, homicide rates actually appear to have increased, which I don't think was the intention here. But is this an effect? Is this a causal effect of this stand your ground law, or would homicide rates have increased anyway? I guess it's the main question that we're trying to answer when we try to estimate the effects of these types of policies. So a typical empirical strategy in that case would be to maybe compare Florida to other similar states. But the credibility of that type of study and those type of effect estimates that you get from those studies will depend entirely on how comparable those states are to Florida. So how do we identify the most appropriate comparison states? So in these settings, I would say that validity is typically judged on two criteria. So when I say validity, I mean the risk of bias. We want that to be as low as possible. And both are related to similarity. So similarity between Florida in this case and whatever comparison state or states that we choose on two key things. So one would be the predictors of the outcome. That could be sociodemographics or gun availability or crime rates or anything else that we think is correlated with homicide rates. But maybe even more importantly, we want these comparison states to be similar to Florida on temporal trends on the outcome before the policy change. So we want to see something like this, where the intervention state and whatever comparison that we use seem to follow the same trends before the intervention takes place. Otherwise, they're going to provide a pretty unconvincing comparison. Like if we have completely different trends on the outcome, they are driven by changes in a lot of other things, and they will probably differ a lot on other things that we can't observe. So we don't want that. So say now that we have the option to choose between 15 other US states that don't have similar self-defense laws. We can then maybe compare to the average of these states, which is what we have in the plot here. So, maybe that could work in this case, but one thing that you might notice is that they are completely different levels to begin with. So maybe we want a comparison state a bit closer in terms of homicide rates to Florida before the intervention. So maybe then we can pick a similar state. Here we have New York. It's not super convincing as well, I would say. Or we can pick an average of a subset of well-selected states. But there's nothing obviously biased in doing any of those. But manually searching for the best choice is a bit unappealing because, well, for one, it can be pretty time-consuming, and at least for me, I'm a big fan of letting the computer do stuff for me if it can to save time. But more seriously, though, it can lack in terms of transparency and maybe formality if we don't set up any objective criteria for picking the best control. And in the worst case, you might end up with picking the control that gives you the results that you want, and we don't want to try to avoid that as much as possible. And also, the final choice may actually be suboptimal because we didn't consider all possible combinations of states. So this is basically what the synthetic control method tries to address. So it uses a data-driven algorithm to search for the best available comparison in the data. It does so with the goal in mind that the optimal control should approximately at least match the intervention state, so Florida in our example, on two things. Like the things we mentioned earlier were important pre-intervention predictors of the outcome and pre-intervention trends on the outcome. And it does so actually by conducting a data-driven search among all possible weighted combinations of comparison states in the data, which expands the search a little bit beyond what we considered earlier when we talked about raw averages and comparisons with single states. And it would be pretty difficult to search among all weighted combinations manually. So this is really where you see why a data-driven method could be a good choice. So the idea is to find the optimal set of weights for this weighted average that construct a new comparison state from the data, which is where the name the synthetic control method comes from. So we're trying to construct a synthetic control state. So in this case, a synthetic Florida without a stand your ground law. And it's basically a weighted average of other states in the data, which is referred to as a synthetic control. And this weighted average should, if everything works as intended, it should be as similar as possible to Florida or whatever intervention state you're looking at before the policy change. So just to see a little bit more closely what it's trying to do without going into too much of the technical details. So the objective here is to find the optimal weights that minimize the difference on two things that we mentioned. So first, the pre-intervention outcome trends. So this data before the policy change. So we wanted to match that in terms of both trends and levels, actually. And secondly, and I guess this is actually technically optional. You don't have to include this to run the synthetic control method. But in most applications, you'll also see people want to match on other predictors that we think are important for the synthetic Florida that we're trying to predict. So we want it to be as similar as Florida as possible on some covariates as well. And in this case, it can be unemployment rates, it could be a number of Republican voters in presidential elections, firearm ownership, violent crime rates, and anything we think could be associated with homicide rates. And it's going to actually do this algorithm is actually pretty advanced. So it actually runs a kind of bi-level optimization to also determine the importance of each of these predictors. So it's going to try to find and prioritize a good match on the ones that are most strongly correlated with the outcome. And it does that because, well, oftentimes we have pretty limited data. So in this case, we have 15 states, and we're not going to be able to perfectly match on each one of these. So it's going to try to prioritize the ones that are important. Well, so if you're wondering about the details of exactly how it does that, I can recommend looking at the first paper that introduced the method. The appendix in that paper has some details on how it does this. But so in the end, so if there's one take-home message here about this whole slide, it's that what we end up with is a set of unit weights that have been optimized to create a weighted average from this data that will, as closely as possible, resemble Florida in the pre-intervention period. And what that can look like is this. So here I've just run the algorithm, and it spits out some weights. And these weights can be interpreted in a relative manner. So 0.35 here, for instance, which is assigned to New York, means that New York has a relative contribution of 35% to this weighted average for the synthetic control state. Maryland has a relative contribution of 26%. So the synthetic control is a weighted combination of these states. And if you get a weight of 0 here, you're basically excluded. So it's determined that, okay, these states are too different to be included. So they've been excluded. And what this can look like then in the end is something like this. So now we have a synthetic control state, synthetic Florida, that resembles the actual Florida a bit more on the pre-intervention outcomes and trends than these other alternatives we looked at earlier. And well, the what we can see here in terms of results is that, okay, so the homicide rates appear to have increased more in Florida than they did in this weighted average of similar states. So we would interpret that as, maybe that actually is an effect of this policy. So just to see a little bit more closely what it actually does, I've just simulated some data. This is completely made up data on some outcome variable y that we can pretend it's homicide rates. It's measured over time in different, say, states, and we have an intervention state. It's a black line here that experiences some intervention or policy change at around the halfway mark. And because this is completely made up, we know what would have happened in absence of this policy change. And so this is basically the line here, the dashed line, what we're trying to estimate. We're trying to estimate what would have happened without the policy change. And the effect is then the vertical distance between what actually happened and what would have happened. And so the synthetic control method runs the optimization on this training period, that's what I'll call it here, with the pre-intervention period, to find these optimal set of unit weights. So each of these lines are going to get one weight. Each of these states get one weight. And taking the weighted average of those lines per time point. So we take the weighted average of these lines per time point, and then we end up with this estimate of the counterfactual. So what would have happened in absence of the intervention. And since this is simulated data, we know what would have happened, and it matches it pretty closely. But of course, in real data, we never know for sure what would have happened. So we always have to, of course, keep in mind to consider other biases, like other things that happen at the same time. But this is the general idea, that this weighted average of these lines here is trained on the pre-intervention period, should match the treated state or intervention state as closely as possible before the intervention. And then if they diverge, we might interpret that as an effect. So some contextual requirements for this whole thing to work. You're going to need to have access to balanced panel data, which is basically data that looks like this. So you need different time series from both before and after the intervention on the state that, or region that changes its policies, and couple of different control states that do not. And we're going to need to have at least 2 potential controls for this whole thing to make sense. It doesn't make that much sense to take a weighted average of 1 control. But you will typically use more. But there are no hard or fast rules here. But maybe anywhere between 10 and 50 is pretty typical in these applications of the method. And preferably, we also want to have a pretty long pre-intervention period in the data to give the algorithm a chance of actually matching on trends. So if we move back to this slide here, we want it to be able to pick up on these different dynamics in the data. And if the time period is too short, it's not going to be able to distinguish between good or bad controls in terms of trends. But there are no fixed rules, and I think it depends too much on the context and dynamics of the outcome that you're looking at to be able to give any fixed rules about that. But preferably long. So what this means is that the method will typically be applied to study regional interventions using within-country registered data. So maybe mortality data. It's usually measured over time by region. So if you have a homogeneous type of register like that, it might be possible to apply the method. In some settings, you might also see studies of national interventions, but that would require pretty good cross-country data that's comparable and measured in the same way over time. So let's just look at some empirical examples, get a sense of what the method has been used for. So I figured we could start by looking at the first study where they suggested the approach. So it's a paper by Alberto Badi and Javier Gardezebo, where they study the economic costs of conflict. They use the terrorist conflict in the Basque Country as a case study. So the Basque Country is a region of Spain that between 1968 and 1997, they experienced a lot more terrorist attacks and conflict than the rest of Spain. So here's just a quick comparison between the Basque Country and the rest of Spain in terms of deaths per million inhabitants per year due to terrorist activities, and it's about 40 times as much in the Basque Country. So they wanted to know, did this outbreak of terrorism affect regional per capita GDP? And their kind of empirical problem that they encountered was that there were really no great comparison regions that they could use. And the Basque Country is quite a bit different from the rest of Spain, or at least it was in the 1960s before the terrorist attacks. And at least in the terms of the outcome, you see a pretty large difference where the Basque Country has had a much higher GDP per capita than the rest of Spain. Also had a larger population density, and other economic predictors also differed quite a lot. So they wanted a comparison that was more similar. So their idea then was to create this method and construct a synthetic Basque Country as a weighted average of other Spanish regions. And what they ended up with was this, where the synthetic Basque Country that they found using their suggested optimization algorithm was a weighted average of Catalonia and Madrid, where we can see in this plot here that it follows the actual Catalonia, the solid line, or actual Basque Country, I mean. And it follows it closely in the pre-terrorism period, but as the terrorist attacks started to spike somewhere in the 1970s, 1980s, they start to diverge in terms of GDP per capita. So we would interpret this as an effect of these terrorist attacks. And Another way to present this that's kind of common in synthetic control applications is to take the difference between these lines. So the outcomes in the synthetic control versus the outcomes in the actual, to estimate the effects per time point. So in the before period, we would expect these to be centered somewhere around 0, but once you implement the intervention, once the intervention is implemented, or in this case, when the terrorist attacks really start to spike, you would expect to see something happen if there is an effect. And what they find here is that the GDP per capita is reduced by about 10 percentage points at that time. And well, their synthetic Basque country is also a bit more similar to the actual Basque country in terms of these other predictors. So a more recent example, which I think was really interesting, is a study from Germany where they looked at the effects of regional face mask policies, where some regions of Germany implemented or made it mandatory to use face masks in public transport and shops earlier than others. So this is just an example from one of these regions, and I believe it's a city, in terms of cumulative number of COVID-19 cases, where in this region, they mandated the use of face masks on April 6th, so pretty early on in the pandemic. And what they find is that compared to a synthetic control region that is very similar to the city of Jena, before this mandate, Jena started to level off in terms of the cumulative number of cases versus the weighted average of these other regions where it continued to rise. So they interpret this as a pretty large effect of this mandate. So what we haven't discussed, what I haven't mentioned, so far, is what you would typically see in many of these quantitative impact evaluation studies is p-values and confidence intervals. Are these effects due to chance? We might want to know that. So turns out that it can be pretty tricky to get valid p-values and confidence intervals for data-driven methods in general, especially in data if you only have a single intervention state. So what they suggested you do instead is to assess uncertainty using what they call placebo studies. So that's one of the things they did in their 2010 paper. So in this paper, they look at the effects of California's tobacco control program called Proposition 99 on the per capita cigarette sales in California. And they used the synthetic control method to create a synthetic control California, and find that, they find evidence of an effect in the expected direction. So there seems to have been a reduction in cigarette sales in California after this point, versus this synthetic control. And another way to express that is this is a variant of what we saw earlier. It's just the difference between the actual California and the synthetic California in terms of cigarette sales over time. And we would expect to see that this is around 0 in the pre-intervention period, and then they start to differ, which we could then interpret as this could potentially be an effect. But what's the significance of this? Could this have been found by just chance? So if we just randomly pick a state in the data and then apply the synthetic control method, maybe we would have found something similar there. So that's what the general idea behind a placebo study is. So it's pretending that the intervention took place in another region at the same time and then running the same analysis there. So here they've done that in the 2003 paper on the cost of conflict, where they ran a similar synthetic control analysis in a placebo region or a placebo study on Catalonia. to see if they could find similar effects on GDP per capita there. And well, the synthetic Catalonia and the actual Catalonia seem to follow each other very closely throughout the entire period. So there's no similar evidence of an effect there, which, you know, it lends some additional credibility to the main result in the Basque country. So what they suggested in the 2010 paper was basically a generalization of this, where you loop over all possible states in the data, run a synthetic control analysis there, and then compare the size of the effect to the effect in the actual treated unit. When you do that, you get something that looks like this, usually. So this is a bit messy, but what we can see here is the plot that we saw before. So the black line here is the actual estimated effect in California. And then the gray lines are the estimated effects using the same approach in all of the other comparison states in the data. And you might notice these really crazy lines over here in the beginning. So what happens here is that sometimes the synthetic control method will fail to find a good match, and then you'll end up with something like this. So in some of these states, the data, you're not going to get a great match, and then you end up with lines looking like this. And to use this as an inference method, you would probably want to handle that somehow. But the general idea is that, you know, we'll compare the distribution of effects in these other states. We compare the actual estimated effect to these the distribution of fake effects in these other states. So as a way to handle the fact that we have these poor-fitting synthetic controls, what they suggested doing, and I realize now this is probably a little technical, but I'll try to explain it. But the idea is to compare the ratio of the average absolute difference between the actual outcomes and the synthetic control in the post period versus the same metric in the pre-period. So if we look at this plot again, we would take the average of the absolute values of this, or more technically, it's actually the root mean squared error, but it's basically almost the same thing. So it would take, makes it signless. So it's not going to matter if it's positive or negative. It's what I mean by absolute values. So you take the average of that in the post period and the average of the absolute values in the pre-period, absolute differences. And that's going to give us a kind of a size of the post-intervention effect that's relative to how different the synthetic control is to its actual values. So what that means is it's going to downweight these really poor fitting units and compare California to ones that are equally good fit. So this will give us a measure of the estimated effect compared to pre-intervention fit. So a big effect in a state with a good fitting control will be prioritized over a big effect in a state with a poor fitting control. And what you do then with these ratios is you can use a histogram like this and check where is California in this distribution. California here is the actual treated unit. And we can see that relative to pre-intervention fit, the estimate in California is exceptionally large compared to these other states. So you use this to calculate somewhat of a p-value. It's what they do, and I tend to interpret this as probability of finding an effect that is equal or of greater size than in the actual intervention unit in this data. So in this data, they have 39 states, and California ranks at the top of this list. So you would take 1 over 39, and you get a probability like this. But if California was in second place, if there was another fake placebo state that had a larger effect, that value would be higher, and you would put 2 over 39 here and get a higher probability of finding an effect of equal or greater size to the effect we see in California. So it's a bit tricky to assess uncertainty in these studies. But another way of trying to do that is you can also shift the intervention date. So that's another thing they suggested, to a placebo date before the actual intervention. So here we have a case where they look at the effects of the reunification of Germany on GDP per capita in West Germany. And basically the idea is that, okay, when we have a really long pre-intervention period, we can shift the date of the reunification in this case, back to 1975, and train a synthetic control in the pre-period using this fake placebo date and see, do we get any evidence of an effect in this period where we should find none? And in this case, they do not. So that would also lend some additional credibility to the confidence to the main estimate. All right, so just going to get into the second part of the talk now, focusing a bit more on generalizations and other developments. So I'm just going to go through a couple. I'm sure this is not going to be comprehensive. So if you know of others, I'll be happy to hear about them later. So I'm just going to go through these fairly quickly. I won't be giving all that much details, but I will provide references. So if you want to learn more, you can have a look at the references. But so one important generalization is that the original synthetic control algorithm could actually only be used for data with a single intervention unit. But many interesting policies are implemented in multiple regions, possibly at different time points. So for instance, the staggered implementation of the marijuana laws in the US. So you might have this type of data, where we talked about this before, which was the case where we had a single intervention unit. But more generally, you might have multiple intervention units with either simultaneous adoption, like every state or region implements in the same year, or staggered adoption, which is probably a more common case where different states implement at different years. And a way to handle that was provided by Zhu in 2017. A really nice paper called the Generalized Synthetic Control Method, where he provides methods and algorithms to generalize the synthetic control method to these cases where you have either simultaneous or staggered adoption of multiple units. So the idea is really, it's conceptually similar, but what we get in the end is average effects relative to the policy change. So in this example here, he looks at the effects of election day registration on voter turnout in the United States, where you have estimated effects relative to the reform, or in term relative to the, and he estimates that about, well, the voter day, election day registration appears to have increased voter turnout by about 4 percentage points. And you may also notice here that we actually have confidence intervals, which, as I mentioned before, can be pretty tricky in these methods. But it turns out that it's not as complicated if you have multiple units, because then you can rely on the bootstrap. That's what he does there. So another kind of nice generalization is that if we want to look at multiple outcome measures, it's typically better to train a single synthetic control to match on all of these simultaneously. So otherwise, we might end up with different synthetic controls for each outcome variable, and that's going to be a bit messy. But it turns out that it's pretty straightforward to extend the synthetic control algorithm to match on multiple outcomes. And software and theory was for that was provided by Becker and Klosner in the paper that's cited here. And she also mentioned that I will give a list of like R packages that you can use to apply these different methods towards the end, almost the last slide of the talk. So I'll show you there. So another interesting development is bias correction methods. So as we saw a little bit earlier when we looked at these different placebo studies, the synthetic control method can sometimes fail to provide a fully convincing control. So sometimes there will be a lot of imbalance left on important predictors or on the outcome trends. So a method suggested by Ben Michael et al. Suggests a way to correct for that. It's called the augmented synthetic control method. It corrects for any bias due to residual imbalance. And it does so by combining the synthetic control method with outcome regression models, which is, it's not going to make a lot of sense to you who are not familiar with this, but the key take-home message here is that, this could be a potentially useful complement in cases where the original method fails. And for those of you who are familiar with doubly robust estimation or augmented inverse probability weighting, it's basically the same idea. So here we have just an example. I would say the imbalance is not extreme, but this is what the original synthetic control method gives in this case. You have some differences here in the pre-intervention period that you might want to handle. And in their augmented version, it corrects for some of that. So another kind of similar idea, but it's a little bit of a different class of ideas, I guess. But the original synthetic control method can actually only be used if the intervention unit is it cannot be used, sorry, if the intervention unit is at the extreme end of the distribution of states. So if we think of this as the data that we're going to use, we need to have a case where the intervention unit is within the distribution of the control data. So the original algorithm is only going to allow for interpolation within these lines. It's not going to allow for extrapolation. So if this is the treated unit, the original synthetic control method will not be able to find a good match. And this is because the unit weights that it optimizes are constrained to be non-negative and sum to 1, which is actually by design because they want to avoid doing this. They want to only use the method if you can construct a synthetic control based on interpolation to avoid extreme counterfactuals, because if you start extrapolating too far from the control data, you might get some really strange results. So, their argument was that don't use the method if you have this case. But recently, alternative approaches have been suggested that allow for some extrapolation, but it will penalize it in the optimization. So that if it can construct a control based on interpolation, it will do that. But if it can't, they will rely on some extrapolation to correct for bias. And there are basically two ways of doing that. So one is to allow for negative weights, or to allow them to sum to something different than 1, which the latter case turns out might be better if you have non-negative outcomes like count data. This is a method that I have a paper that's going to be published in Epidemiology in a couple of months, where I suggest doing this if you have count data, but it's really similar to the ideas in the augmented synthetic control method, which is what that does is basically allow for negative weights to handle this bias here. And this is just an example from the paper that I'm working on, where the original synthetic control method fails to find a good control for Sweden. And where I'm looking here at a road safety policy on fatality rates in road traffic accidents. And basically, Sweden is at the extreme end. It has been for quite a long time. It's one of the lowest fatality rates in the world in terms of road traffic accidents. It's difficult to find a synthetic control based on interpolation, or you're not going to be able to. So allowing for extrapolation in that case will give rise to a better control, basically. So there's also been some progress in developing statistical inference methods, so actually getting confidence intervals for synthetic control methods. So I'm not going to go into the details here, but some relevant papers for those of you who are interested, or I think these three, there may be more, but I think these ones appear to be the most useful to me. Especially this last one, which is a practical and robust t-test that is pretty easy to implement. So if you're going to look at any of these, I would suggest looking at the last one here. And to sum up here, see this is just a list of these software implementations. So if you're interested in implementing this method, using this method, there are a couple of packages. So the original synthetic control method can be applied using the synth package for Stata and R or MATLAB. And the other generalizations, you have to turn to R to apply, I think. If you know of other packages for other programs, maybe you'll tell me later, but the generalized synthetic control method is the gsynth package. If you have multiple outcome measures, it's a package called MSCMT, and the augmented synthetic control method is implemented in AugSynth. All right, so some final remarks before we get to the discussion. So goal, right, of SCM is to provide a data-driven framework for selecting appropriate comparisons in policy evaluation studies. The data requirements are a bit steep, which potentially will limit applications, the number of applications that you can use it for. But some recent developments in the synthetic control literature have greatly extended the amount of situations where it can be applied. So I think that's it for me. Thanks for listening.
Thank you ever so much, Carl. That was absolutely fantastic. Such a clear and concise run through what's become a very influential method. Absolutely fantastic. Thank you ever so much.